In the United States, multiple states are reporting upticks in COVID-19 cases. The CDC says the EG.5 variant makes up the largest proportion of new infections, and that includes a subgroup of variants nicknamed Reyes. The World Health Organization is tracking it and other variants. Experts believe more travel and crowds this summer are contributing to the spike. Wastewater surveillance data is also being used to track cases. States no longer have to report numbers after the U.S. public health emergency ended in May. While infections are much lower than in the past, between 300 and 400 Americans are still dying each week. With me now to discuss this summer surge in COVID is Dr. Peter Chin-Hong. He's a professor of medicine and infectious disease specialist at the University of California, San Francisco. Always great to see you. We've been talking about this issue for years now. So I want to ask you what you are seeing, the reports of these new variants. How would you assess COVID right now?
Well, Elaine, I think it's more of a swell than a surge. This is the fourth consecutive summer of numbers. And it may mean that COVID is going to settle down into a little swell in the summer and a bigger increase in cases in the winter. However, fewer people are overall getting seriously ill. We have vaccines, we have Paxlovid, remdesivir, but some people are still dying, like you pointed out. Whether or not it's fueled by these new variants like Reyes and Arcturus remains to be seen. But nevertheless, we are definitely seeing increase in test positivity, increase in wastewater, increase in emergency room visits, and increase in hospitalizations.
You know, anecdotally, I haven't seen anyone wearing a mask all summer until very recently. Where do things stand on an updated vaccine? Should people get boosted in the next month or two, or now, or mask up? What advice do you have for people who are trying to wrap up their summer vacations? Kids around the country are starting to go back to school. I know in the South and here in the next couple of weeks, my kids will be going to school. What would you advise?
Well, Elaine, if you had asked me that question a month ago, I would say everyone should just wait until early October when the new COVID vaccine is slated to come out. But given the slight increase in cases now, I'd say if you're older than 65, if you're immune compromised of any age and you haven't gotten a vaccine for more than 6 months, which is most people, you should probably go ahead and get it. But for everybody else, probably waiting is still going to be okay. We do know that you have Paxlovid and other therapies, even if you do become infected and you're one of the high-risk folks. But for general advice, I myself have been taking around my mask a little bit more often, definitely wearing it, going up to board the plane, deplane, thinking about it more in public transit whenever there are crowds. And not to put a buzzkill, but there have been a few cases associated with Taylor Swift concerts as well.
I did hear about that, and a lot of concerts still happening. Beyonce was here this weekend. Are people still testing, and are they reporting it? Do the numbers, are they actually higher than we realize? Because, there aren't the free tests, there aren't, now you have to buy them. Who's actually reporting their cases?
I think that's a great point, Elaine. Even in the variant reporting, they're probably driven by three main jurisdictions around Georgia, California, and New York. So not a lot of universal testing. And individually, a lot of people are not even testing anymore because many people have very, very mild symptoms, and they seem to be very, very mild in most people right now. But again, that mild symptom in someone can have more serious consequences than another. I'm not saying go crazy, but I think that we should just not forget about it.
There are still a few people out there who have not ever been vaccinated, and there are still a few who have managed to not ever get COVID. What would you say to those groups of people, or any advice for them?
Yes, I mean, if all else fails and if you forget everything else, do remember that we can still get people out of the hospital, prevent them from getting seriously ill by within the first 5 to 7 days having access to Paxlovid or remdesivir. And even if you're not into getting vaccinated, I think the availability of that therapy can definitely mean the difference between having a terrible course or one that's milder.
And I guess to wrap this all up, when you see what's happening around the world, it's not just here in the United States, a couple of swells, as you say, in other countries. Could you consider this a seasonal virus now? Are we at that point, you think?
Well, I think everyone was hoping that it'll just be once a year in the winter. But again, with 4 consecutive summers now of an increased cases in the summer, it seems to be settling down into a mild summer and a more serious winter going forward.
How would you want to leave this? Anything else you want to add that I may not have touched on? I mean, I think, you know, there's a little bit of more awareness, like I said, as people are still trying to finish up the summer and looking ahead to fall. And any advice you have going into the fall?
Yes, I mean, I think we've focused on, you know, serious disease and death as a bad outcome, but do remember that COVID can be very disruptive as well, travel plans, kids in school, etc. So I think it behooves all of us to just be a little bit more aware around these times in particular.
And one last quick thing. I know it seems to be a little bit milder, but same guidelines apply if you do have COVID, the same amount of time to stay home, that sort of thing?
Yes, so generally in the US, 5 days of isolation. That's been changing in other parts of the world. But if you forget anything, don't go out when you're feeling sick, or at least wear a mask. There are lots of other viruses floating around, and that mask can help protect others from multiple viruses.
All right, always great to get your take and an assessment and some last-minute advice. Dr. Peter Chin Hong, always great to see you. Thank you for joining us from San
Thanks,
Francisco.
Elaine.